Around the world, citizens are becoming increasingly disconnected from their leaders and institutions. To give citizens a stronger voice in their education and healthcare delivery, the World Bank's Global Partnership for Social Accountability is supporting Oxfam and the Institute for Governance Reform to produce a citizen scorecard on service delivery in all MP constituencies and local councils across Sierra Leone. It was adopted by the Ministries of Health and Education and successfully debated in Parliament in December 2021. Here are some highlights from the debate.
If there's anything we should learn, it is to back policy with good analytics.
Yes, you're right.
To use good analytics to target public policy and programs. And I think this is a superb example, and I pray that we get to the day where Parliament has resources to be commissioning reports like this for different sectors.
Because the distance of accessing health centers in my constituency are so far off. And even the current one, I'll give you an example, the one in Meniko. It is better for a woman to deliver outside than to deliver in the hospital in Meniko. This report really gave us an opportunity to see the picture of how my own district is. And that is why we were saying it's not just one to say we discuss it, but we are also waiting for us to see the ministry responsible to know that we acknowledge this report as bad as it is. It reflects the true picture of our district and our constituencies. And most of, Mr. Speaker, most of these challenges that are here, even the writers of this report will tell you when they went to our constituencies, the blame was not given to local council that we are meant to repair these ones, but they will tell you our members of parliament are doing nothing to solve the problem.
Mr. Speaker, as I have already mentioned about the state of education in these remote areas, attention needs to be given. Many terms have been given to the Minister of Basic and Senior Secondary Education with regards to education. Attention needs to be given to remote areas.
Few things that I highlighted from the very report. Number one, I noticed there are strong recommendations on the recruitment of remote teachers. This is very important. Those days, we used to have remote teachers and remote allowances, and it has been doing us well. And the recommendation in maintaining retired teachers with strong background in subjects like literature, English, and mathematics.
I am recommending this report strongly to government. And in fact, if in the resolution, and in fact, I would love to see that the Minister of Education and their staff are invited by the committee for a joint session where elements of this report are really discussed. Because we keep saying we've allocated 22% of the budget to education. What this report does for us for education or other sectors is, okay, after we do that, let's go back in and check value for money.
Is the document together? Because it's very, very important. And a document which has to be kept for history. But this document now is honest, straightforward, and factual. This is why we would recommend it.
The government of Sierra Leone can consider training some teachers and heads of schools to enable them to provide manual health care and referrals in schools. These are very important. Because when we wanted to open schools during this pandemic, there was a lot of challenges in the schools with the health sector, both sectors. We are fighting. What do we do? What are the parameters? No healthcare officers around. No, we have not trained them. So they are saying in the future, if you are talking about pandemic, we should be able to train teachers in the health, to train people who can take care of the health service for our children.
Citizen feedback has been received and debated at the highest level of policy in Sierra Leone. And now the Speaker has put the motion for adoption of the SDI to vote.
All those in favor, say aye.
Aye.
All against, say nay. The ayes have it.